common driver of joint pain and fatigue. Hey folks, Todd Mansfield. I'm a clinical herbalist here in Byron Bay, Australia. And today we're talking about the intersection, the root cause of a lot of symptoms. Before I started doing organic acids testing, I didn't put much stock into oxalate overload in the body, hyperoxaluria. I have been finding loads and loads and loads of oxalate overload in the system. So patients will say, look, maybe they come to me with an OAT test. They say, look, I have an oxalate overload. I did a low oxalate diet. I didn't see any improvement. And again, I don't think that the diet is really the intervention or, again, the root cause. Something has broken down along the way to contribute to that oxalate overload or that inability to process oxalates and get them out of your body. So there's a link in the description below. Don't forget you can follow along, you can read. There's lots of references that I've included. And a lot of this is also from clinical experience as well. I find that very valuable. You get the data, you put patients on a treatment plan, reduce the oxalates, treat the root cause. Huge, huge, huge kind of advocate for that. And you see improvements. Retest, oxalates have normalized or significantly improved, and that's kind of confirming that oxalates were at least a part of that person's health journey and health issues originally. So oxalate overload is common. It's definitely more common than I thought in my patient population, in the people that I test for oxalates. And originally I was doing a oxalate urine test, and that's very binary. I mean, it'll say, yep, you've got oxalates, and yep, at this amount, this is a problem, but you don't really have any of that background data on why. There's a few different reasons why. Number one, it would be fat malabsorption. And so when fat is just running through you and you're not absorbing it in the small bowel like you should, it's not getting emulsified by bile. Most of those patients are experiencing watery diarrhea. Sometimes the bowel movements are floating and they're mushy. Sometimes there's a bit of like an oil slick in the toilet bowl. Those are classic symptoms of fat malabsorption. And the connection there with oxalates and fat malabsorption is that when there's an excessive amount of fat in the digestive tract and it's not getting absorbed into the body, it's actually forming a complex with calcium in the diet, and the calcium is then not there to form a complex with oxalates, calcium oxalate. And so if you can form a complex calcium oxalate in the digestive tract, then you can actually just poop out those oxalates. No harm, no foul. All good, we're on track. Again, if the oxalates aren't forming that complex with calcium in the gut, it's getting absorbed into the body. We're testing it through the urine, right? It's excreted through the urine, but it's also getting lodged in different tissues and joints, causing inflammation, and even the process of detoxifying the oxalates through the urine is going to start wasting your sulfur. The second major cause or driver of excessive oxalates in the body would be either fungal overgrowth or mold. And depending on the mold, it's not all mold. We've got some pretty good data on aspergillus, the green mold, either exposure in the environment or aspergillus growing in your digestive tract, candida as well, exacerbating and contributing and producing a lot of those kind of excessive oxalates in the body. So again, a patient comes to me, they've got high oxalates on their OAT test. They say, look, I cut down on oxalates. Didn't feel any better. I say, whoa, what's driving that? Why do you have excess oxalates in the urine? We need to rewind, treat the root cause. Maybe it's mold. Maybe it's fat malabsorption. So here's a great little photo, scanning electron micrograph of oxalates taken from Wikipedia, and you can just see how kind of sharp and painful these things look. And again, when it's excessive in the body, that's a major cause of pain, joint pain, muscle pain, fatigue as well, that's huge. And look, this is just a little kind of simple summary. There's an update on oxalate crystal disease, this piece right here. And that's really the problem, you know, when we're thinking about symptoms that are associated with oxalate overload, the list never ends. It could be most things. Pain is huge, osteoporosis is huge, you know, heart, arrhythmias right here. Every kind of body system under the sun can be impacted by excessive oxalates in the body. If we are talking about treatment, again, we want to be addressing the root cause. We want to be bringing the body back into balance, addressing fat malabsorption if that's the issue. Sometimes that's SIBO, sometimes that's celiac disease, some form of gut damage is really big. Sometimes it's genetic, you know, issues with methylation and bile flow can be huge. Treating the root cause on the mold front in the environment is pretty complex. We'll save that for a different video. Mold in the body, we're on antifungals, we're on binders, that's really big. And then if we're thinking about a nice kind of simple plan to help kind of bind and eliminate those excessive oxalates in the gut, almost as a little bit of a band-aid, a bit of a preventative so it doesn't get into the body, we are thinking about calcium and a lot of these alkaline minerals as well. So it could be something like calcium, could be something like magnesium. The citrate bound forms are really, really helpful. That's all very potently alkalizing. And look, restricting oxalates in the diet, I go pretty kind of light on that one. I would be slowly eliminating oxalates in the diet. If you like the video, make sure to like it, leave a comment, subscribe, that really helps. And if you are looking for support with digestive health, you're living in Australia or New Zealand, then reach out to the clinic. I'd love to hear from you.